For the Health of It is brought to you by Cooking with Cancer. For more information, log on to cookingwithcancer.org.
Hi, I'm Edie Hand.
I am Dr. Luis Pineda.
And we welcome you to our show today for the Health of It. And Dr. Pineda is going to share some tips for us about taste and smell that's going to help make your life a little bit better, I hope, today.
Well, thank you very much, my dear. We have been dedicating the last couple of programs to problems related to the mouth.
Yes.
And we have been talking about the dryness, and we are talking about the inflammation of the mouth. And today we are going to be dealing with a concept of stimulating the taste by exchanging flavors. And we are going to combine some cheeses with some strawberries and with some herbs and balsamic vinegar, which will help to control symptoms of the mouth, provide comfort, provide nutrition, as well as provide some antioxidant effect, which is a cancer protector.
Well, that's great. And I know that we're also going to have Dr. Dumas on the show with us today, and he is a radiologist oncologist. So stay with us. We're going to be right back with Dr. Dumas.
Dr. Luis Pineda has dedicated the past 25 plus years to serving needs of the community as a hematologist and oncologist. His office is conveniently located off Highway 31 in Vestavia at 1909 Laurel Road. Also at the 1909 Laurel Road is the headquarters for Cooking with Cancer, Inc. Helping those afflicted with cancer enjoy a better quality of life through good food. For more information on Dr. Pineda and his medical clinic, visit us at www.drpineda.com, or to set an appointment today, call 205-978-3570. To learn how you can raise awareness, go to www.cookingwithcancer.org. Luis F. Pineda, MD, PC, making a difference in cancer care.
Hi, and welcome back to For the Health of It. And joining me here in the kitchen is Dr. Fred Dumas and Dr. Luis Pineda.
Pleasure being here there.
Welcome, gentlemen.
Thank you.
And we've been talking about mosquitis. So I know that our viewers out there that are going through radiation or cancer, you know what these gentlemen are talking about. And from our last show, thank you for coming and joining us again, Dr. Dumas. And we talked in our last show about some of the treatments and what you recognize that happens to your mouth. And so where would we go from here to kind of educate them, give them a little overview of what we talked about and what we can get into today to help them a little bit better with their situation if they were going through mouth or throat and their face type of cancers?
Thank you, Edie. And Fred, welcome again. You are very kind to be here. And, you know, I reemphasize the concept that we are here for the people out there to try to get them educated into what is happening to them. Mm-hmm. And we have been concentrated basically into the effect of radiation inside of the mouth. Mm-hmm. And we have talked about the mucositis, and we were talking about the dryness of the mouth, and we were talking about infections in the mouth. And then we kind of miss a little bit about a concept of osteonecrosis. Can you tell us a little bit about what that is?
You know, osteonecrosis is death of bone cells, and it's one of the most feared complications of radiation therapy. In the 1960s, if you were going to have mouth radiation for a tongue cancer, the first thing we would have done would send you to the dentist and take all your teeth out.
Wow.
And the idea was that if you didn't have teeth, then there would be no way for an infection to get into the jawbone, because what can happen is an abscessed tooth can turn into a chronic infection that ends us up with an operation to remove the jaw. It's a serious complication.
Very serious.
Thank goodness it's rarely seen, and we don't take people's teeth out. We repair their teeth now, and we try to prevent that complication.
Right. Tell me, what kind of things can people do or yourself do in terms of trying to avoid these complications?
Well, the first thing was what we just said, good hygiene, maintaining your teeth. So if I see somebody who's going to need radiation to their mouth and they're going to end up with a high risk of dry mouth, we'll send them to the dentist, get their teeth repaired first. avoiding the things we talked about in the last show, avoiding tobacco and alcohol and irritants that are going to make things worse. Part of the planning, part of it is my responsibility to use radiation therapy to minimize the dose to the salivary glands and to the jaw itself. That's going to cut down the risk of osteonecrosis.
You know, when you were talking about this, really good hygiene, so that's why it's so extra important that we really go to our dentist to make sure we get those cleanings, that deep cleaning, and just anything we can do for our personal hygiene makes us help us avoid what could happen to us.
And the dentist needs to be aware that radiation is going on, and most dentists know what to do when this is going on, but they will do an extra cleaning. They will repair any teeth that need to be repaired, make sure that they've taken x-rays. They will sometimes make fluoride trays, and we'll do daily fluoride treatments, not the monthly or every 6-month type treatments that you'd get at the dentist normally.
Okay.
You can do some other things, and I understand that there are some new kind of equipment that is being used that can be of help. Can you tell me a little bit about it?
Well, one of the newer forms of radiation we use is something called IMRT, intensity modulated radiation therapy.
Is that less invasive?
It is different. It is still an external radiation therapy, but as opposed to a radiation field coming in from one side and from the other and treating all of your salivary glands, by dividing the radiation field up into many, many smaller fields, you can paint the radiation on the tumor to avoid doses to those critical structures. So we can reduce the dose to the salivary glands. That's where the dry mouth comes from. That's where some of those long-term side effects come from.
Okay.
Does the problem with the mouth happen pretty soon after the beginning of the radiation, or is it a late effect?
It's some of each. You see the changes in saliva. The saliva thickens, the taste goes away. That happens 2 or 3 weeks into radiation therapy. As you go further into the radiation, if you're in 4 weeks out of a 7-week period of treatment, that's when you start to notice the mucositis, the sores in the mouth, the infections that happen. The things like osteonecrosis and xerostomia, which is that dry mouth, those are long-term side effects. Those are effects that you'll see 6 months to 2 years after radiation therapy. And most of the long-term side effects of radiation you're going to see them by then. Now, something like an osteonecrosis, that's a little different. Osteonecrosis, where the bone dies, can happen because something has insulted that bone after it's already been damaged by the radiation. The radiation is probably damaging the small blood vessels that supply the blood to the bone. So a year later, 5 years later, you get an abscessed tooth. That infection is what sets up the damaging event that leads to that death of that bone.
You know, as a patient, if I feel this and I know that this infection is coming on, does that mean it's more advanced, or is it something, you know, when it's already there? How can you even help yourself for preventing?
You have to be aware, and so
Just be in tune to your body?
doctors have to be aware too.
Okay.
But sometimes it is pain. Sometimes you'll have a painful spot. You'll go to the doctor, and sometimes prolonged antibiotics will prevent that. If it is something that's a little worse than that, we might send you to a hyperbaric oxygen chamber, because that oxygen will help to drive the oxygen into the cells and allow them to heal. Sometimes limited surgery can be done. So it's important to come in early and to be seen on a regular basis, and it's important to see somebody who knows what they're looking at.
Well, I want to ask both of you this question, is that if as a patient and you're listening to your body and you know this is happening, and all of a sudden you're on long-term antibiotics, can that affect you by being on long-term antibiotics? What does that do for a patient if they have to be on, say, I'm talking about for years?
Well, these antibiotics are for a bone infection. I might treat somebody for 6 months.
6 months.
So it could be like a thing. But typically you're going to take antibiotics for 6 weeks to 2 months to 3 months, and you'll see some healing during that time. But yes, if you're on chronic antibiotics, you're going to change the flora in the gut. You're going to have risk of diarrhea and all the side effects that come along with long-term side effects. So there are some other issues. Now, you try to choose an antibiotic that is not going to do that. You'll choose something like a simple tetracycline antibiotic, or something that's going to work more topically, because that's what you want it to do in the oral cavity.
Okay. Well, I think we have time for another question.
Well, there is no doubt to the fact that medical intervention has to be measured and appropriately prescribed, no doubts about it. And I think that what we are seeing in our conversation is that, well, we have a bad problem with cancer. We need to use a treatment that will do some damage, but there are things that can be done, and that as time goes by and new technology and new medications are available, you can do a lot with these people.
We've spent quite a while talking about some serious complications like bone necrosis. I've not seen a bone necrosis this year. I think the technology that we have now, where we combine limited doses of radiation, chemotherapy, limited surgeries, we use our technology to maximize their impact, has really improved the cure rate and maintained the complication rate at a very low level. So the likelihood that somebody is going to be cured is better than it's ever been, and the complication rates are lower as well.
That's wonderful. I want to thank you again for joining us for both of our shows, Dr. Dumas, and I know that people at Brookwood Hospital and across this state are fortunate to have you.
Thank you very much. I've enjoyed it.
Thank you. And Dr. Pineda, thank you for introducing him to us and to all of you out there. We hope that you will stay with us. We have more coming up on the show, so don't miss it.
Dr. Luis Pineda has dedicated the past 25-plus years to serving needs of the community as a hematologist and oncologist. His office is conveniently located off Highway 31 in Vestavia at 1909 Laurel Road. Also at the 1909 Laurel Road is the headquarters for Cooking with Cancer, Inc. Helping those afflicted with cancer enjoy a better quality of life through good food. For more information on Dr. Pineda and his medical clinic, visit us at www.drpineda.com, or to set an appointment today, call 205-978-3570. To learn how you can raise awareness, go to www.cookingwithcancer.org. Luis F. Pineda, MD, PC, making a difference in cancer care.
Hi, I'm Edie Hand, and joining me in the kitchen is Dr. Luis Pineda. And how are you today?
Doing great, thank you. And nice being here with you, my dear.
Well, we're having a good time in the kitchen just for you out there, right?
That is correct.
And what are we going to be cooking up today with Cooking with Cancer?
Well, I will say one more thing all over again, my dear, and that is you don't need to be a cook in order to be cooking.
Hey, I like that.
Most
women out there like that.
And as a matter of fact, we are not, in essence, using any heat or anything like that for this. We are, however, using simple recipes that are inexpensive, easy to make, and that they do fulfill some of the needs that people do have whenever they are going through problems related to the mouth, either because of chemotherapy or because of radiation therapy.
Okay, wonderful. And today, I know we've got something, like you said, that we're going to mix up some cheese and the strawberries to wake up our taste a little bit.
That is correct, because if you remember some time ago, we talked about the receptors of the mouth and the taste of it, right?
Yes.
And we said that the receptors were almost like a rubber band that stretches and then save energy and releases it by jumping on it, okay? Whenever you have a receptor that has been damaged by radiation or chemotherapy, you can no longer taste. The way of bringing them back is by conflicting flavors that contrast enough that will wake them up.
Is that the same for children and adults?
You know, we don't know that for sure, and that is a point that I will want to make, because a lot of this is referred to an adult, but we don't know what happened with children. And as a matter of fact, we have a program with Children's Hospital in which we are trying to obtain information from children going through radiation and chemotherapy by submitting recipes of the things that they were able to taste and enjoy during their treatment
Soothing
time.
to their mouth and they could digest.
Right.
Okay.
And we have a contest, and the winner actually get to go to Walt Disney in Orlando, pay by Cooking with Cancer. The whole idea then is to help children, to help people, and to get to know a little bit better what happens to adults and children at the same time.
All right, well, let's get into this
Okay.
recipe.
Well, very simple. I have my strawberries, and a strawberry is an interesting thing because it's cold.
Mm-hmm.
Number two, it has a bite to it.
Yes.
Number three is that whenever it's already maturing, it has, if you would, a little bit of a mucousy texture to it, which will coat the inside of the mouth.
I can understand
Nonetheless,
that.
we will go ahead and basically clean this up, and I have
Or you could just
put in-
de-stem it, yeah.
just basically put it in there, and I have
And this is the cheese.
that have the cheese, and basically I have made this, but I have actually a cutter, and this cutter, of course, is a fancy element, but if I just pass it through here, you will see how my slice come through.
Well, I think it's just like a physician having the right tools. You got to have your right tools in the kitchen.
And then I
There
will
you
have
go.
it nicely in there, and then I basically will have a little mint, which will basically a way of decorating it. And then I'm gonna drizzle with a little bit of balsamic vinegar, which will help me to provide this contrasting of flavors to it.
Mm-hmm.
And then there you got it. Basically, you have,
Oh, look at this.
let me just pass it here to
Right
the back
there.
so that we can see it a little bit better.
And it's in our little Cooking with Cancer bowl here. And give them the name of the recipe again, because they could go on your website at cookingwithcancer.org and find this.
That is correct.
And the name of the recipe is?
Well, basically, it's Parmesan cheese shaved with strawberries and vinaigrette balsamic.
Well, you know, I love it because you can't go wrong with Dr. Pineda's recipes because he reinforces in his names of his recipes into what he's preparing so that it just helps put in our subconscious mind how easy and simple and economical it really is, right?
In addition to that, I should mention to you that there is some research that has proven that strawberries have an antioxidant effect and actually have an anti-cancer effect as well.
So it's healing.
It's a healing process as well.
That's wonderful. Well, we know that this is a recipe that can help you to make a difference in your life if you're going through something with your mouth and in your throat. And certainly even when you go through radiation and chemotherapy, whether it's just to the mouth and that, the body needs something that's soothing to it and that it can digest anyway, right?
That is correct. Well, you know, Dr. Dumas talks about how important nutrition is. And unfortunately, one of the things that get neglected the worst when it comes to cancer therapy is precisely the lack of good nutrition. And the whole purposes of the program then is to increase the awareness of that process so that not pretending to have the answer to your questions, we are hoping that you can come up with answers that will help us to help you and some of the people going through that endeavor.
You know, and that's why it's important that for Dr. Pineda's staff and office to be able to get you the answers you need. If through this program it's helping make a difference for you, you could simply either call his office or you could log on to cookingwithcancer.org and we'll try to get you the answers. I can tell you this, if there's something that that someone might not know right then, they'll do the research and find it out. Right, Dr. Pineda?
Yes, ma'am. It will be a pleasure to do so.
All right, so you stay with us. We are going to be right back with more Cooking with Cancer for the health of it.
Dr. Luis Pineda has dedicated the past 25 plus years to serving needs of the community as a hematologist and oncologist. His office is conveniently located off Highway 31 in Vestavia at 1909 Laurel Road. Also at the 1909 Laurel Road is the headquarters for Cooking with Cancer, Inc. Helping those afflicted with cancer enjoy a better quality of life through good food. For more information on Dr. Pineda and his medical clinic, visit us at www.drpineda.com or to set an appointment today, call 205-978-3570. To learn how you can raise awareness, go to www.cookingwithcancer.org. Luis F. Pineda, MD, PC, making a difference in cancer care.
Hi, I'm Edie Hand, and welcome back to For the Health of It. And joining me is,
Dr. Luis Pineda here.
and
I'm Gia Panetta.
I'm Gina Siebert.
the team of us are really here so that we can answer questions just for you, right, guys?
That's
Yes, ma'am.
right.
And today, I know that Gina has gotten some great questions from some of you that you have emailed her. Now, Gina, if people are emailing something for Pickles here, our little mascot, how do they do that?
Well, if you
It's
want to
new.
mail into Pickles, all you have to do is go to pickles@cookingwithcancer.com.
That's great. And also, I see you've got a pretty little bracelet on here. Do you wear that to kind of create to being a good steward, or what do you do?
Yes,
with that?
I actually do wear it a lot so I can aware people about cooking with cancer, and I actually wear it to school a lot.
Well, that's cool. And you like pickles?
Yes, pickles is amazing.
Hey, Dr. Pineda, I mean, she's a good cheerleader for us, you know? And, of course, if people wanted to get one of these wristbands, how would they do that, Gina?
Well, Miss Edie, to get a Pickles, all you have to do is go on to our website, www.cookingwithcancer.org.
Is there a phone number, too?
There's also a phone number where you can make an order for people in the Alabama area or outside the Alabama area, 205-978-3568.
All right. Well, share with us a question, if you would, that might could
Well, let me see what we
answer
got
for the
in.
viewers.
You know, it's turning off cold. It's fall time. And I actually was looking through some of these questions to see if our viewers had anything like that was in mind. And one of the questions I have is, what cautions should I take for the change of seasons? Dr. Panetta?
Yeah, right. Well, you know, different seasons, different times. But in particular, say, for example, right now, we are leading into the fall. And the fall will cause for all these leaves to fall down. It's dry. This is going to produce a little bit of powder that gets elevated into the environment, and that creates trouble with the lungs and can be a potential problem for infection. So we always advise people during this period of time to be conscious about this situation and try to avoid to stay out during those periods of time. Now, it can change according to the season. If you get into the winter time, well, make sure that you are warm. If you go into the summertime, remember that overexposure to the sun can actually cause significant troubles with certain chemotherapies that sensitize your skin to the sunlight. In general, however, the point that I will make to you is that you have to feel comfortable with the way you dress.
All right.
Right. That's what that SPF's for, right? That SPF 50.
All right. What's something else?
Let's see. Another question I had that came up was, can I eat the day of chemotherapy?
Well, absolutely. And I will say to you that we actually encourage you to do something. And of course, different people, different ways. But I don't want you to come for your chemotherapy on an empty stomach and potentially having trouble because of that. My suggestion to you is that you try to get something that is light, that is acceptable, that is tolerated. Check with the people where you take your chemotherapy or your radiation therapy. Sometimes they can offer to you certain things that they know may be beneficial to you.
Yeah, that was too. I know when I went through it, is that because of nausea, you know, that if you wouldn't going to have nausea and that, what about something you drink? You know, would you be able to drink something before?
Oh, absolutely. You know, the whole point is don't come on an empty stomach. That can actually be much more of a problem.
So it's better you can eat or drink.
Right.
Okay.
Right.
So you want to make sure that you can keep your blood sugar up. Check with the facility to see if they possibly have snacks or drinks, or I guess even provide lunch.
Yeah. And I go back again. Everybody is different. Everybody is individual. And everybody should actually do what he thinks to be the best. But in general, it's always wise for you to try to eat something light before you come into chemotherapy.
Because everybody's body chemistry is different, right?
Absolutely.
Okay. We have time, I think, for another question here.
Okay. Let's see. Dr. Pineda, I think you might enjoy this one.
Well, thank you.
I know I enjoy this one. I want to hear the answer. I really enjoy a glass of wine or beer. Can I still drink?
Oh, well, yes. Well, thank you. I enjoyed it.
Listen, I don't, but if I ever start, I'd probably be an alcoholic.
No, but I will make a point about this situation because, you know, it may be for some people controversial, but the fact is that wine or alcohol in general is known to have some medical positive effect. Being as it is that we know that it stimulates the appetite, and perhaps that is one of the most important reasons why for people with cancer, taking chemotherapy, taking radiation therapy, I strongly encourage you that you drink at least a glass of wine before dinner time. I think that that is going to help you not only to relax, it's going to help you with your appetite, and it's going to help you to have better nutrition to it. Besides that fact, it is true to say that there is substantial benefit in terms of cardiovascular effect of wine or alcohol on people's life. People have less heart attack, less stroke, people live longer with it, the so-called Mediterranean diet.
So it really is a way to help us relax, you know, a little bit. A little wine is a good way to relax. And you heard it first right here. So what is this, and this bottle that we've got of wine here, what does that say on that?
Well, it is a point that we want to make because we really care for people with cancer. And this is actually a wine that relates to our awareness with breast cancer. And is
Right, you'll find that anywhere. And I think the proceeds actually, a lot of different companies and makers of, like the person who makes this wine, are donating proceeds back to Susan G. Komen, breast cancer awareness, those kind of things.
Well, I want to thank everyone for being a part of our show. You know, we've had a good show again today, Dr. Pineda. And is there anything you would like to say, Gia, out there to your friends that are watching? Anything with it?
Well, I just want to aware everybody about how great this is, and I just want to say that it's really a good organization, and it's going to help a lot of people.
Thank you. And, of course, now, Gina is our voice of Pickles, and what does Pickles always say?
Well, Pickles always says, life is what you taste of it.
And thank you again, Dr. Pineda.
Thank you very much. Yeah.
And join us again on For the Health of It.
Dr. Luis Pineda has dedicated the past 25 plus years to serving needs of the community as a hematologist and oncologist. His office is conveniently located off Highway 31 in Vestavia at 1909 Laurel Road. Also at the 1909 Laurel Road is the headquarters for Cooking with Cancer, Inc. Helping those afflicted with cancer enjoy a better quality of life through good food. For more information on Dr. Pineda and his medical clinic, visit us at www.drpineda.com, or to set an appointment today, call 205-978-3570. To learn how you can raise awareness, go to www.cookingwithcancer.org. Luis F. Pineda, MD, PC, making a difference in cancer care. Dr. Luis Pineda has dedicated the past 25 plus years to serving needs of the community as a hematologist and oncologist. His office is conveniently located off Highway 31 in Vestavia at 1909 Laurel Road. Also at the 1909 Laurel Road is the headquarters for Cooking with Cancer, Inc. Helping those afflicted with cancer enjoy a better quality of life through good food. For more information on Dr. Pineda and his medical clinic, visit us at www.drpineda.com, or to set an appointment today, call 205-978-3570. To learn how you can raise awareness, go to www.cookingwithcancer.org. Luis F. Pineda, MD, PC, making a difference in cancer care. Dr. Luis Pineda has dedicated the past 25 plus years to serving needs of the community as a hematologist and oncologist. His office is conveniently located off Highway 31 in Vestavia at 1909 Laurel Road. Also at the 1909 Laurel Road is the headquarters for Cooking with Cancer, Inc. Helping those afflicted with cancer enjoy a better quality of life through good food. For more information on Dr. Pineda and his medical clinic, visit us at www.drpineda.com, or to set an appointment today, call 205-978-3570. To learn how you can raise awareness, go to www.cookingwithcancer.org. Luis F. Pineda, MD, PC, making a difference in cancer care.